The U.S. needs an additional 200,000 nurses a year to meet patient care demands. Expanding nursing education and healthcare training programs is a big part of the work that's being done to meet that demand. Carthage College is already stepping up to meet the need with its new School of Health. Opening this month, it's expanding training opportunities and preparing students to meet the needs of healthcare in the future. Here to tell us more about the Carthage College School of Health is Nancy Reese, Associate Dean of the School of Health. Thanks so much for being with us.
Thank you so much for having me. Carthage College is so honored to start the School of Health this year in response to not only the needs that are here in the Kenosha-Racine area where Carthage is located, but also across the state of Wisconsin and the nation and honestly the world. Carthage College is partnering with many people within our areas to address the shortages, not only in the long term with college degrees, but also in the short term with healthcare education, such as CNA. We have assessed our partners with the start of the School of Health. We interviewed over 72 stakeholders to identify what they see their needs are for the future of healthcare. And we know that Carthage College and our dedication to liberal arts education, body, mind, and spirit, we will be effecting a difference in providing healthier tomorrows here in Kenosha and globally.
Why was this the right time, though, to really launch the School of Health?
In this past year, we had over 11,000 applications at Carthage College. 5,500 of them were for healthcare professions. So when we evaluated where are students who love Carthage College, who are interested in who we are and what we do, and saw that the vast demand, we knew that this was an opportunity for us to share the goodness that we already have within our nursing program. You see, our nursing program was begun in 2016 with 13 students, and this upcoming fall, we'll have over 500 BSN nursing students here on campus. We're the most popular program on campus with nursing. I am the director of nursing as well. But we also saw that our allied health science program is the largest growing within our college as well. And we're very blessed and combining many other opportunities to be able to have those coming to our school be able to embrace where they are called within the healthcare professions.
And we do want to talk about some of those different healthcare professions that you provide training for as well. But I do want to start a little bit initially with just talking about the fact that healthcare is really being reimagined every single day. How is this new school really going to help students to be prepared to meet the new technology needs that exist within healthcare? Because they seem to be changing every day.
They are changing every day. And in addition to technology, we also have a healthcare workforce that is begging to have greater skills to be resilient, to thrive within healthcare. And I use thrive very deliberately because we've seen over the past decade burnout happen within healthcare professionals. So one of the hallmarks of Carthage College is that we look at healthcare as the World Health Organization does, where we talk about the state of complete physical, mental, and social well-being. And that means that our well-rounded education provides tools for our students to be able to navigate the dynamic, the quickly changing environments that we have within health. Of course, we have a lot of different opportunities to embrace the future, such as within the nursing program, we have a virtual reality suite where the students have Oculus headsets and they have patient scenarios where once they immerse themselves in that virtual world, they are transported to the bedside of a patient and able to do assessments and interventions and reassess the outcomes as they're working with that digital patient in that virtual area. Many hospitals across the nation are using this technology for education for their teams, for example, in ERs and other complex situations. We're preparing our students today within that virtual education world to embrace the healthcare of tomorrow.
You were mentioning that there are a number of different disciplines that students can study, train, perfect their skills in, and the School of Health. So it's not just nursing. What are some of the other areas that young people can find out about, study there at Carthage in the School of Health?
We truly are an interprofessional, interdisciplinary school of health. And so, like I mentioned previously, allied health science, which includes imaging, ultrasonography, athletic training, all those types of things are in allied health science. But we also have preventative things like exercise science. We have a research arm, which is neuroscience, where many of our pre-medical and pre-health professionals major within neuroscience, where they're working with research studies on stressors within animals and analyzing cell slices to be able to determine how the effects of health are affecting an animal body. We also have sociology, criminal justice, because that social environment is so important to the whole person. Social work is there as well. And of course, pre-health and pre-med pathways, which I mentioned with neuroscience. All of these come together in a proactive package where we're not only looking at health prevention and disease promotion, we're looking at restorative care with athletic training and others. We're looking at mental health care with social work, that social care with sociology and the research arm, and then, of course, nursing cares for the body, mind, and spirit. So we are very proud of our team and the opportunities that our students have to work collaboratively, because healthcare is a team area. We're collaborative, and that's what's important.
And it's interesting because at Carthage, students are getting that from the very beginning, right? They're not really isolated from other folks who are studying in other areas of healthcare because they're all there in the School of Health.
That's correct. And we all take the same oath about being dedicated to being creating meaningful opportunities to follow vocation. Here at Carthage, we're very big on vocation, which mean in Latin, the root means to call. And we take that very seriously as what are we called to do in the world to care for our neighbor, to make a difference within the healthcare environment.
When you look at how the School of Nursing has just grown so much in a very short period of time and in just about 10 years, and you look at the potential of the new School of Health, what kind of difference do you see it making in the short term and in the long term for people in Kenosha and Racine and throughout southeastern Wisconsin when it comes to having access to healthcare?
I'm going to take it one step further to a program that we started a year and a half ago, which is Certified Nurses Assistant. And this program was one that honestly, I wasn't sure how it would take off. Well, I was proven wrong. We have waiting lists for our Certified Nurses Assistant program. We've trained over 300 in the past year and a half. And this summer, we have 3 sessions, and each of them have waiting lists. And many of the people who are coming to Carthage College for this education are community members. They're not necessarily students, the typical college age. They're people who just want to care for others within our community. And so, what Carthage College is dedicated to providing are pathways to education, working with the clinical providers and others within Kenosha, Racine, and southeastern Wisconsin to be able to have pathways to be able to provide better health care for those that we love and those that need care within this region.
Nancy Reese from Carthage College and the School of Health, thank you so much for being with us and all the best to you.
Oh, thank you so much for the support and the opportunity to share all the great things that are happening here at Carthage College.
You bet. Well, that is it for us this week. Be well, take care, and we're back again next week with another Connect MKE.